World Health Organizations advocate that sepsis is a main target of burden of disease. Sepsis actually is a syndrome whereby a patient having infections but get into very serious conditions, and their own body respond toward the infections, cause damage of their own internal organ and lead to that. And there's a lot of patients actually having a sepsis but come to hospital very late, especially those who have diabetics and also got some comorbidities. Currently, sepsis was diagnosed in hospital only. There is only machines in hospitals that can test on sepsis and also need to take blood from the vein, analyze 24 to 48 hours before they can give you the result. This device is first in Malaysia, namely SepsiDot, comprised of two parts, which is the reader and also the strip. So there's a two version of this. This is the upgrade version, the reader as well, and also the strip. These two devices actually can give you a very simple and rapid way of diagnosing the sepsis. Our technologies can reduce this burden by using one drop of blood from the fingertips. In 10 minutes time, they can tell you the result immediately and whether you have sepsis, and we can give the treatment as soon as possible. We depend on this result. The specialty of this device also is GPS tech. We can real-time monitor where is the occurrence of sepsis happening, and we might able to send the rescue team to the location immediately if you need help. This device can bring to home to the patient bedside. There's advantage on this because there's a lot of logistic issues that can be solved by this small and portable and cheap device. This can be used by the GPs, especially when their clinic is limited space. This small machine can really help them and assist them to get the rapid diagnosis of sepsis done. These innovations mainly created for public, especially those public with somebody elderly at home, or they have like immunocompromised, like cancer patient at home, even they have diabetics at home. This also created for those who can bring it for traveling or pilgrimage. It can be used in the war zone, especially war zone which is aftermath, whereby the limited resources of medications, so you need to triage whether who should use the medications, who is important. This also can use for all the sport events. You see, if any injuries or any athlete that is fever, then you can triage whether they can continue with the sport or they can bring to hospital. This device can change the whole ecosystem of sepsis treatment. It can reduce the mortality for sepsis as well as it can save life. With the G7 support for the sepsis prevention and also early detections, our device really can help in making this aim successful. We would like to make sure that the sepsis burdens reduce, and we want to make sure that Malaysia is free from sepsis.